Hello, everyone. This is Senior Biotech Analyst John Vandermosten. Welcome to our channel that educates the life sciences investor on exciting advancements in drugs, biologics, and devices. For more content and news like this, subscribe to our channel below and like or share with others. Welcome to our discussion today with Lexaria Biosciences CEO Chris Bunka. Chris, it's a pleasure to speak with you again. Lexaria is a drug delivery technology company, and it's working on products that can address hypertension, smoking addiction, and a lot of other things. So tell us about your DehydraTECH platform, how it works, and really, aren't you just hacking the digestive system's ability to fast-track fats?
Sort of. And we're working symbiotically with the body's natural systems. Your body actually manufactures certain fats every single day, whether you know it or not. And those are done to aid in digestion and also to help your body cross the blood-brain barrier using something called fatty acid transport mechanism. Lexaria's technology is believed to work with these human systems and designed to help them work even better.
So one of the benefits of DehydraTECH is that it gets things into the bloodstream faster, and there are a lot of situations where that's really important. Two of the ones that you're talking about, right now are hypertension and smoking. What are some examples of situations where this can really help with medicines that exist right now?
Absolutely. Well, I mean, hypertension and nicotine addiction, of course, are two obvious ones, but they're chronic. So if you think about things that are more acute, and I ask anyone to think about loved ones that you may have or people you know who may be afflicted with seizures, epilepsy, or otherwise, or pain, even something like erectile dysfunction. If you think of those three areas, for example, speed for the time required for a drug to be effective is a really, really important factor. And no one wants to wait any longer than necessary to combat pain or seizures, for example. So our tech is able to really, really help reduce the time lag from the time you take a medication to the time that it works, greatly reducing those problems.
And DehydraTECH can be used or administered in a couple different ways, at least, either through the GI system or through the mucosa in the mouth. Why is it important to have multiple administration pathways? And are there other ones besides that where it might work?
Yeah, this is actually a fascinating area for us, John, and I really appreciate the question because DehydraTech was originally developed for intestinal absorption only to help deliver beneficial molecules across the intestinal wall. Quite accidentally, we discovered that it actually has effectiveness in other areas of the body. So, tissue membrane barriers. So, you can think of obviously the intestinal barrier, the mucosal membrane, as you mentioned, in your mouth and throat, and even the blood-brain barrier. Turns out that DehydraTech has already been evidenced to be effective in all three of those categories. And it makes a huge difference to us as a company in the long term because all of a sudden we can be talking about different form factors. So you think about a capsule that you swallow, that's intestinal absorption. You think about something that melts in your mouth, a lozenge or some sort of chewable, that's going to be absorbed primarily in the mouth and throat. Or you think about skin based cosmetics or creams, obviously designed for skin based absorption. So, the delightful news for us and our shareholders is that our technology has already been evident to work in all three of those areas.
Yeah, that's great. And the blood-brain barrier is one of the more exciting areas because there are a lot of drugs that work well in the normal system, but they can't cross into the brain. Are there some examples of things you're working on there with the DehydraTECH that merit mention?
Yeah, absolutely. And we'll get into it. But one of the things that we discovered in the hypertension program we were doing, of course, is we were focused on intestinal absorption to try to get more of the drug into the bloodstream. And we were hopeful that we would be able to affect something called vasodilation or kind of an expansion or relaxing of the blood vessels, thus lowering blood pressure. We did all that and we were delighted. But we also discovered that we were really penetrating the blood brain barrier much more effectively. And our clinicians told us that, well, this is actually very serendipitous because hypertension is primarily centrally mediated, i.e., your heart is the pump. but the computer that controls the pump is your brain. So central mediation of blood pressure is a very important factor, and the ability for us to deliver a drug more effectively across that blood-brain barrier can have profound effects on the way the brain is communicating with the heart in order to try to bring that blood pressure down.
Great, Chris. Well, I appreciate the succinct rundown of DehydraTECH and what it's capable of. Again, this is Lexaria Biosciences CEO, Chris Bunka. Ticker symbol for the company is LEXX.